Welcome people. In this video we want to cover anti-leprosy drugs, okay? So, pharmacology, please pay attention. So, what is leprosy? Leprosy is a chronic infection, correct? It is a chronic infection. It is caused by Mycobacterium leprae. It's a bacteria, right? It is caused by Mycobacterium leprae. It is an acid-fast bacilli. Earlier they used to think it is not curable, but it is entirely curable, okay? It's entirely curable and but if there are any defects or deformities which have formed, those cannot be reversed, okay? So is this clear what leprosy is? Is the introduction clear for you? It is also called as Hansen's disease. Leprosy is also called as Hansen's disease. So basically it is caused by Mycobacterium leprae, okay? It is a curable chronic infection, okay? It is characterized by skin lesions and nerve damage, okay? Now let us move on to types of leprosy. Types of leprosy, there are, what you will learn actually is tuberculoid leprosy and lepromatous leprosy, right? In tuberculoid leprosy, what happens? There will be cell-mediated immunity. So there will be granuloma, etc. This actually it is actually showing that it is able to fight against the bacilli. However, in lepromatous leprosy, there is no cell-mediated immunity. Cell-mediated immunity is absent. Lepromin test will be negative. This is showing bad. Lepromin test negative means the body is not able to fight against the infection. Fine. So it progresses to anesthesia of distal parts. So basically sensations will be lost. Atrophy, ulceration, absorption of digits. All the digits, the fingers will get absorbed. Let me show you. Can you see this? Absorption of digits. All this happens in lepromatous leprosy because the person is not able to fight the bacilli. Then there is one more classification here called NLEP classification. In this they are classifying it as paucibacillary and multibacillary. So in paucibacillary there will be 1 to 5 skin lesions. In multibacillary there will be more skin lesions. Okay. In multibacillary more than one nerve will be involved and there will be positive skin smear. Okay. So this multibacillary is like lot of skin lesions, more nerves are involved and positive skin smear also. Anyways, now let us go to the classification of the drugs, okay? The anti-leprosy drugs. Look at this. You have 4 here: sulfone, phenazine, anti-tubercular drugs and other antibiotics. Sulfones, you know, sulfonamides, Dapsone, DDS. What is DDS? Diamino diphenyl sulfone, okay? This is the oldest, cheapest and even now it is used most widely. Dapsone. So Dapsone leprosy. Try to link it, guys. Dapsone leprosy. This is a sulfonamide. Obviously, what will it do? Sulfonamide will stop the synthesis of folic acid. And bacteria cannot make folic acid, so there will be no DNA maturation, replication, nothing can happen. Then you have phenazine derivative, clofazimine. This is what clofazimine is. Phenazine derivative. It's leprostatic activity it will have. It will bind to the mycobacterial DNA and inhibit the template function. So it is a leprostatic drug and it has anti-inflammatory effect. This will be useful later. You will see in lepra reaction you will use this effect, anti-inflammatory effect. Moving on to the other drugs, you have the anti-tubercular drugs, rifampin or rifampicin, then ethionamide. So this we have already covered in the previous videos, right? Rifampin, ethionamide and anti-tubercular drugs. Other antibiotics which you can use like ofloxacin, moxifloxacin. What are these? Floxacins. What are floxacins? Fluoroquinolones. Minocycline. It's a tetracycline. Then clarithromycin. Clarithromycin is what? It is a macrolide antibiotic. Sometimes you might get confused with the names in this. Clarithromycin is macrolide. What is streptomycin? That is aminoglycoside. So now is it clear the classification of leprosy drugs, anti-leprosy drugs? Sulfone, Dapsone, phenazine, clofazimine, anti-tubercular drugs like rifampicin, ethionamide, other antibiotics like ofloxacin, moxifloxacin, minocycline, tetracycline, and then you have macrolide like clarithromycin. Okay. What else should we look at in this? Dapsone they have asked once, and clofazimine you should know. Then multi-drug therapy regimen in leprosy. So multi-drug therapy in leprosy and the highlights of it. We'll look at all this in detail. Lepra reaction, because of the drugs you give, there could be a lepra reaction. What exactly happens in the lepra reaction? There is type 1 and type 2 lepra reactions. How will you treat it? You have to discontinue Dapsone if it is a severe case. Clofazimine is effective in controlling the reaction because it has anti-inflammatory property. Then you can prescribe prednisolone, that is corticosteroid. Okay. Other drugs which will help are analgesics, antipyretics, antibiotics. Anyways, all this we will read in detail. So basically in this video what we have seen so far, we have taken an introduction to anti-leprosy drugs, and we have looked at the types of leprosy, and we have looked at the drugs classification for leprosy, right? Let's continue in the next video. See you. Bye bye.